Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Pregnancy signs and symptoms at 13 days past ovulation. You may want to know whether or not your body is showing any symptoms that may give you a positive indication. Watch on to learn more about pregnancy symptoms 13 days past ovulation and what you can expect. What is 13 days past ovulation? At 13 days past ovulation, the HCG or human chorionic gonadotropin levels in the body are in substantial amounts and, thus, may even cause early signs of pregnancy. However, where some women may experience pregnancy symptoms at this stage, others may feel few or no symptoms at all. Also, these symptoms are sometimes very similar to symptoms that you may experience every month before your periods. However, if you observe carefully, you may be able to tell whether or not the symptoms you are experiencing relate to pregnancy. What are the pregnancy signs at 13 days past ovulation? Number 1. Cramps. You can experience mild cramping at this stage in your lower abdominal region. Number 2. Spotting or bleeding. Unlike menstrual bleeding, implantation bleeding is very light in flow and color and may last 2 to 3 days. Number 3. Nausea. Experiencing 13 DPO nausea can be one of the pregnancy signs for you. Number 4. Fatigue. Fatigue can be one of the early pregnancy signs and symptoms that most women experience. Number 5. Changes in breasts. Your breasts may be tender or sore to the touch. The dark area around your nipples may grow in size, and your breasts may get bigger too. Number 6. Food cravings. The hormonal changes may make you crave certain foods and dislike certain foods and smells. 13 days past ovulation and big fat negative test, BFN test. We know that fertilization takes place anywhere from 6 to 12 days past ovulation, but in some cases, it may take even as long as 15 days past ovulation. All this may sometimes show a BFN in your pregnancy test at 13 DPO. Therefore, it will be a good idea to wait for 5 to 6 days or until you miss your first period post-ovulation to take a pregnancy test for a BFP. What if you don't have pregnancy symptoms at 13 DPO? If you do not experience any pregnancy symptoms at 13 days past ovulation, there is no need to feel disheartened. This may happen if you may have ovulated later than usual, which is a very common phenomenon in women who have irregular periods. Also, fertilization may take longer than usual, so you may exhibit no pregnancy symptoms at 13 DPO. Remember that every pregnancy is different, even for the same woman. You can take a pregnancy test at 13 DPO as there are good chances of getting a positive result. However, it will be a good idea to take a test again after a few days to confirm your pregnancy. Meanwhile, if you have any concerns or queries related to pregnancy, you should get in touch with your doctor.